As an ER nurse and a mom of 5 wild kids, few things scare me more than patients falling through the ice. It's estimated that there are 25 fatalities a year in the United States from people falling through ice and drowning. And part of the problem is that ice can be super deceptive. Where I'm standing right now doesn't get any sunlight, and this ice is about 3 inches thick, and it can hold steadily a thick-bootied mama like me. Whereas over here we get way more sunlight, it can't even handle a little bitty landscaping rock. 17-year-old Gwenny would have absolutely tested the ice down there and thought, it's perfect, it will hold me. And I would have tried to skate across the entire thing and fallen through. And there's a few things we need to know as EMS or emergency room providers to be able to care for these patients. Number one, do not go out on the ice to try to rescue these patients. I know everything inside of you is going to be screaming to go rescue that patient, but we're only going to double the trouble if we find ourselves now under the ice. So we need to wait for the appropriate crews and the equipment to be able to rescue these patients. Then once we get them to the shore and in the ambulance, we've got to strip off their cold, wet clothing and actively rewarm them as quickly as we can. And remember the changes that we make in our hypothermic arrest patients. We know that the blood is not circulating because we have such a clamp down in the peripheral vasculature that when they are below 30 degrees Celsius, we only give 1 dose of code drugs until we get them back up to 30 degrees. And then we're going to give them at double the intervals, meaning instead of every 3 to 5 minutes, it's going to be every 6 to 10 minutes while we're working them and they are a cold cardiac arrest. But the most important thing that we can do as people who are like Farmers Insurance, we know a thing or two because we've seen a thing or two, is try to educate the general public and especially our own family members. My kids know that they are not allowed on this ice ever. Don't tell them I was out here making a video, because I know all too well the dangers of them falling through. And then when our muscles are super duper cold because we're in 30-degree water, we're not able to contract. Even the strongest of swimmers are not going to be able to keep their head above water in this super cold water. So be safe, stay on dry land, stick around for some ice ASMR.